Hello, this is Dr. Barr. I just wanted to discuss the very interesting topic. I just came back from a conference and there was a lot of information about brain's health and a lot of research and a lot of new development that is exciting for us to be able to help our patients. So today my topic is supercharging, supercharge your brain, and there's a lot of new information about charging the brain. And now we are going to be discussing one of the significant benefits of light therapy. This therapy is going to change brain's health. It's amazing. A lot of research coming out of there with very, very exciting results. So, light therapy in medicine, we're calling it photobiomodulation, PBM. This is the use of light energy to trigger a certain photochemical changes in the brain. Mostly, we're talking about organelle inside the cell. It's called the mitochondria. So above me there in that circle, you can see that squiggly worm looking. It's the neuron, a nerve cell. And inside those cells, or every cell in our body has a mitochondria. Our mitochondria is a powerhouse. And the photochemical reaction is actually occurring in these mitochondria to stimulate them through red and near infrared light. So the mitochondria produces the cellular energy. It is the powerhouse, and the commodity or whatever it's uses for energy is called ATP. The currency is ATP. So ATP provides energy in the brain cells. So you see in that diagram there's ionic gates or light gates in our cell membrane in the green circle with the membrane, and that's the mitochondria with little arrows going in there. So there is gates for light, and then the second one on next to it, the purple one, that's your DNA, starts transcribing, meaning it starts creating a message. It reads the code and starts a message inside the cell, neuron or nerve cell, and that message is to produce ATP. So the light energy leads to greater blood flow to the brain, allowing the delivery of nutrients and removal of the waste products. So the ATP is the energy we need for delivering nutrients, removing out the waste. So very interesting. One of the diseases that have been studied, and it's just unfortunately one of the diseases that we do not know have any cure so far. And when somebody gets that diagnosis, it's sad. So because we don't have a cure for it, but now there's promising results through light photobiomodulation. So there's clinical studies, and there's a reference on the bottom in the Future Science. The article showed in 2024 that was really suggesting that the photobiomodulation, also the low light energy, that's another name for it, has the potential of slowing the disease and also reversing the progression of Alzheimer. That's very interesting because we don't have much for those patients currently. So this is an Alzheimer pink brain there, and on the right side where there's this blue looking bone, it is showing that there is neurotransmitter or cholinergic transmitter that is usually depressed. On the top part, it shows autophagy. Autophagy is also another process in the cell that's being suppressed. And on the very colorful one, there's inflammation and neurodegeneration. All these three little ones on the top. Now, if you look on either side, that kidney-shaped organelle is the mitochondria, and you see as it actually is inflicted by the disease, it becomes squiggly and shrinks, and it kind of dies off. And on the other side, there is reactive oxidative stress, and when this happens, the oxidation stress resulting from the inflammation unfortunately reduces the amount of energy. ATP is not produced as much. So let's look in the rectangle in the center that's light yellow. This is the light, that little button with the radiation things on the side. This is the spectrum of the light. The one that we're focused on is the far infrared, the red light. It's 810 nanometers. That's the wavelength that we're using. And above the brain there, we're pretending there's a cap or something above the brain that is creating that, emitting that energy. And once that is done, you can see in light green, there's different things that happens to the brain, improve the production of ATP, reduce the cytochrome or the inflammation that happens, and that's how the brain is being healed. And there's the reference here in the center of that slide. So this is great news for Alzheimer and people losing memory. Now, the next disease that was discussed also is Parkinson, which is another disease that doesn't have, unfortunately, good promises so far with any of the medication. And when somebody gets Parkinson diagnosis, unfortunately, it is sad. So in the recent clinical studies, if you look here at the blue brain, there's a pink dot. At that pink dot, it's magnified on the right side. It shows that in a normal brain, we produce a lot of chemical transmitter or neurotransmitter because that's dopamine. A lot of us know dopamine. And dopamine is important for that specific disease. And you can see in Parkinson, the lower diagram shows that there's very little dopamine produced. So in a recent study, the clinical showed that photobiomodulation therapy has shown a very effective results on individual diagnosed with Parkinson. They were able to improve their gait, the speed, the stride, and also the length of their stride, and improve the balance, which is very important. And that was a study completed in 2017, another one in 2020. And then also another study by Moreau showed that the motor function improved in Parkinson's disease, which is amazing results as well. And that's just by applying a cap, light therapy, certain time. It doesn't hurt. It's not surgery. It's just very easy to apply. So another cool thing that I would like to report, some of the clinical studies showed that PBM, photobiomodulation, light therapy, improves the sleep, which is super cool, because if we can improve the sleep quality and the duration, that's what matters. So it's not only duration, we don't need to sleep long, but we have to have quality so we get into REM so that we can induce that state of healing and repair. So the individuals reported that with sleep disorder that they improved their sleep, which is cool. So PBM affects the circadian rhythm. That's what we know. Circadian rhythm is that cycle that produces melatonin. So melatonin is the hormone that is crucial for us to get into the sleep cycle. And it comes out at night. It's produced by pineal gland, and it responds greatly to darkness. So that's why I tell people, if you want to sleep well, no TV lights and no extra lights, just darken the room, put something in your eyes, and keep it quiet. But the darkness is so key to start that cycle for sleep. So first of all, darkness stimulates melatonin, and then after that, to be awake, you need light. So when you wake up, you get the light, sunlight. So to get that cycle, it's very important to follow it. It's melatonin, darkness, and then it is suppressed by light exposure. And then when we want to wake up, we just wake up and look at the sun, and that stops that cycle. So PPM, improving sleep. How many of us would like to have a good night's sleep? So this is a very simple thing. Light therapy, specific wavelength, can improve sleep. Not a pill, not addictive at all. It's super cool, no side effects. Another thing, like another study, which is very cool, is that we found that it affects anxiety and depression in a very amazing way. So because it releases certain neurotransmitters, we know that now. So a study showed people with generalized anxiety disorder reported that they improved their score of anxiety was reduced in 8 weeks treatment, which is not too long. And also they said they slept well, which was great. And then another study that was only 2 to 4 weeks after single treatment with the near infrared on their forehead. And that was 10 patients, and they reported anxiety and depression improve, which is super cool. And these are the reference on the bottom. So does it work for anything else? Well, I'm an anti-aging longevity doctor. I love wellness. I love making life healthier for everybody so that they can live longer and stronger. So PBM has a wide range of wellness benefits for the health individuals. So if we include it, it improves the cognitive function. So we can focus better, we can produce better, and also reduce the inflammation of the brain and enhance the mood. How does that do? The cognitive benefits we know because it increases the blood circulation and the oxygenation in the brain. So who wouldn't want that? PBM also stimulates the mitochondria, so will give you more energy. more energy for your brain cells. That is very important for performance, for cognition, for memory, and for all the functionals that we need to perform well at work or, in life. So mood, we know it affects your serotonin and dopamine. So mood is enhanced, and that is really cool. So people are happy. Great neurotransmitter, making you feel good or happy. That is amazing for wellness. I think that's one of the really winner, for me. Now, people would say, like, why would I do this? Why would I even think about it? Because you know what? Again, maybe we don't have Alzheimer right now. Maybe we don't have dementia. Unfortunately, we're seeing higher numbers. The reason is there's so much environmental neurotoxicity. And that is something that I want to bring your attention to, especially in this quick presentation, because even though you might not have any issues, but I want you to watch for these things. These are common environmental exposures. So I'm going to go from below up. Fluoride is everywhere. Fluoride is something that's in the toothpaste. Unfortunately, they forced this on us. Lead, mercury, and cadmium. These are heavy metals. Lead is in fish. Mercury is everywhere. Cadmium, these are the battery stuff. It's affecting us because it's in the whole environmental, exposures that we're used to. Mycotoxin is mold. So a lot of people are exposed to mold. Look at pesticides. Pesticides is everywhere. If you don't eat organic, or even if you eat organic, we see pesticides still residual in so many things. It's in the soil, it's in the waters, and it's in so many foods right now. So it is unfortunate. Pesticide is another burden on our brain. And that's one of the reasons to heavy metals and pesticides. I always check if somebody comes for dementia or Alzheimer, we always check them because that's one of the reasons that cause degenerative brain problems. And maybe they will improve much if we just remove those burdens. So that's one of the things we do for anybody coming with starting to lose his memory or focus or the shakes. But also BPA, I want to tell you guys, phthalates and BPAs and plastics and PCBs. So where are these? Like they're, again, PCBs were something that was prohibited in the United States, but it's still in fish, meats, dairy products. We breathe it in the air, it's in the water. And, plastics, BPA, even if you think about it, one of the biggest things is your supermarket, or when you go have dinner, they give you that little teeny receipt. That is the worst one. That is the worst one. So microplastics and stuff like that. Diesel exhaust. Maybe you don't drive a diesel car, but it's everywhere. It's in the air. And manganese, for those you guys that work in mines, but again, doesn't have to be in a mine. We still see these environmental toxins everywhere. So I recommend, and I do this for my patients, I measure urine for everyone. I usually try to do a challenging test sometimes and just measure for all these toxins, because we know these can cause neuroinflammation, meaning like it will hurt our brain and it looks red and unhappy in that picture. Now, there are some tests now, new tests that I found interesting. So Galactin-3, we used it for other diseases like cardiac and so forth, but we're knowing that galactic, and this is a simple test that we can get in LabCorp right now. It looks cute, like a keychain right now. But we know that it affects and damage the brain and affect the microglia. So now we can test for that and find out if it is abnormal. So now it recognizes as a neuroinflammation, microglial activation, and neurodegenerative disease progression. Okay, so it's a marker for that. So if you haven't checked your Galactin-3, go for it and monitor it over the years, right? Because we want to know how this is developing. Now we can track progress. I love that because we can now track progress, and we can track progress if we're doing the helmet and the light therapy and all that kind of stuff. People would say, oh, I'm feeling better. But guess what? We can do QEEGs, cognitive assessments. There are brain tests right now that we can check the waves. It's amazing. And we do it in the office. It takes like 20, 30 minutes and we're done. And then, of course, the clients or the patients say we're feeling better. Now, I just want to quickly report a few new things that are out there that are amazing, and actually we're part of this clinical studies, the TB006. This is an antibody that is going to be targeting those inflammations in the brain for Alzheimer. It's amazing. They might get it also for Parkinson. We're still waiting for that. But it is amazing results. over 50% of the patients reporting great improvements. For somebody who did not have much hope when they're given dementia or Alzheimer, it's just a matter of time. We gotta get caregiver, and it's a decline. So unfortunately, we did not have too much progress, and the medications that are out on the market usually don't work. So TB006 is a great infusion now that we can make. Actually, I'm part of that group, and we're trying to have it available for all our patients who are interested. So this is really cool if we are going to do the TB006, and then we can actually track the progress, right? Because now we also can measure the GAL3, right? And all the other parameters. Another things that I usually like, and I do a lot of, kind of prevention to protect the brain. I love some neuropeptides. So I'm just going to throw it out there. There's several neuropeptides. One of my favorite is CMAX. It's a neuroprotective peptide. This has been used a lot in Russia, Dr. Kabenson, and over the last century. So they've treated so many people. It helped people to regain their cognitive skills, stimulate the brain to come back and recover, which is really important. But it's also neuroprotective. So I take it every now and then. And cerebrolysine has been used for stroke, another peptide. It's not available in the United States. People usually order it and we infuse them with it. But if they want to, so it's great for traumatic brain injury. People who had strokes and brain damage, unfortunately, they can get that, and we get them infused. It's super cool. They get it from Europe, and it promotes the neurogeneration. Now, on the lighter note, I found that the light therapy is so cute, can help you grow your hair. So if somebody's thinking about my memory is getting weaker, and for all good purposes, there's an added benefit for that light therapy. With that specific wavelength, it can help the hair to get into a growth cycle. So not only, so there's like as added benefit there. If you're gonna help your brain to be strong and healthy and regenerative treatment for your brain, you're also gonna get some good hair. Isn't that cool? I don't think it's a bad side effect. Thank you so much for joining me today. I hope you enjoyed it. And if you have any questions, send us comments. Don't forget to subscribe. And if you have interest in any topics, please let me know. I would love to start any topic you want. Thanks. Related to what I like to do, which is regenerative medicine and functional medicine. Thank you. I didn't do that.